The battle against COVID-19 will be won at community and personal levels at an Eastern Cape hospital, says the province's healthcare facilities are faced with not only an increasing number of COVID-19 patients, but staff shortages due to increasing numbers of COVID-19 infections. Among them, the staff. GroundUp's Dr. David Stead, who's the head of medicine at Cecilia, Makiwane and Frere hospitals in East London, says the historic problem of an underdeveloped, underserved and less robust health system in the Eastern Cape has worsened the burden of healthcare professionals. This as South Africa recently recorded nearly 60% more natural deaths than expected in recent weeks. Dr. Stead joins us now. A very good evening to you and thank you so much for joining us. So you've been quoted as calling the system broken. Just how broken is it? And give us a sense of the health system's capacity or lack thereof.
Good evening, Tabisa, and good evening to the viewers. It's functional, but there are parts of the system that are broken. Just historically, the Eastern Cape, on many levels, and including health, has been under-resourced and underdeveloped. So we from baseline, much more vulnerable to a health crisis like COVID. And COVID-19 has humbled some of the most advanced, well-resourced health systems in the world. So there's no country that's really, who's had significant numbers that's come through unscathed. But in a province like the Eastern Cape, you are much more vulnerable with less robust health systems, management. For example, ambulance services being very short at the best of times, vacancies in hospitals. It's more sort of acute in some hospitals in the province than others. There's been some, news reports from Port Elizabeth where it's been particularly dire at times. But we definitely, as a health system, are much more vulnerable to the stress that COVID-19 has placed on us.
So I want to talk about the province. It's seen a doubling of infections in a 2-week period, from 29,340 to 55,584. What percentage of that is healthcare workers?
I can't tell you the percentage. My perspective, so I work in East London at two large hospitals in state hospitals in East London, and we've had significant numbers of healthcare workers, over 250 at the one and a similar number at the other. That's nurses, doctors, laundry, kitchen, the whole spectrum, getting sick, which has really been a double whammy in a way. That as we seeing a surge of patients coming into our casualties, requiring beds, needing to open up extra capacity, extra wards. We've had large numbers of staff going off sick, actually having to admit a significant proportion of our sick staff who depend on state health. So that really has, at its peak, it was quite touch and go at times as to whether we'd hold together, whether we could actually, provide a service. Unfortunately, things haven't collapsed. We've had brief closures of units, ICUs, casualty briefly, where there was a large number of staff needing to go off either because they were sick or they were needing to quarantine at the time. But fortunately, at the moment, things are a little bit more stabilised. We've had many of those staff coming back, recovered, and actually at the moment, our staff absenteeism is a bit better than it was 2 weeks ago.
What physical, psychological or resource support is there available for hospital staff? I believe in general, one of your greatest fears, for instance, is deciding who gets oxygen. So how is this obviously impacted on the general mental health of healthcare professionals, especially if some of them are either not getting PPE in terms of resource support, or they're being forced to reuse them, or they're afraid of infecting their families back home?
It's a big issue, to be so, and it's something we as we sort of getting a little bit of a handle on the clinical caseload that we're trying to get more attention to, and definitely staff on all levels are taking a lot of strain. There's a lot of fear, and there's been a lot of loss. We've had staff dying, we've had nurses dying, some of them dying in our wards. Nurses having to nurse their colleagues, and some who haven't survived. So that's extremely. It takes a huge amount of strain I think it's felt a bit like we're in a war, and that we've, as healthcare workers, been conscripted to fight this invisible enemy without much choice, to be honest. But that's that's really the vocational space we're in, and it goes with the territory. But I think people have largely just kept going because you've had to, and the crisis is. In a wartime, you just have to press on. So I think that's what most of my colleagues are doing. There are some supports that have been set up for doctors counselling doctors through the South African Medical Association, and there is some volunteers have come forward to provide counselling. There hasn't been, I don't think there's been extensive enough support, to be honest, on the psychological impact. I suspect we're going to be picking up pieces once the pressure's off from the clinical side.
So 4 months on, I'd imagine that you have some sort of insights into how best the battle against COVID-19 can be won at community and personal level.
Yes, I mean it's the same messages really, not much has changed. It's really about adhering to them and everyone taking personal responsibility for their behaviour and for doing their best not to be part of the transmission chain of COVID. So the masks, definitely there's increasing evidence that they really do make an impact. Especially when interacting in public spaces, on public transport, to be really vigilant with keeping your mask on, social distancing, avoiding congregating indoors. Some evidence that there may be an airborne component, so ventilation indoors and avoiding crowding in indoor spaces is essential. Hand hygiene, being vigilant with that. That's we still. While at the moment my personal focus and our teams is around caring for the sick, which is requiring a huge amount of effort. The only way we're going to really drive back the epidemic is breaking the chain of transmission. We're obviously trying to prevent infections happening in hospital, but the bulk of infections is obviously happening in the community. So that really just comes down to individuals taking responsibility. I'm aware there's a lot of fatigue, and we're social beings, and it's very difficult, not to be able to socialize and connect with friends and family. But we just need people to persist in doing their best to flatten the curve.
All right, thank you so much for your time speaking to us. Infectious diseases specialist Dr. David Stead. He is the head at the Cecilia, Makiwane and Mount Frere Hospital, speaking to us about the plight of healthcare workers 4 months into COVID-19 and the lockdown.